Alrighty. Hang on a minute, what was that? We're good. Okay. Alrighty, I think we're live. And I really am so delighted to welcome today's guest. And that is Hannah from Canine Arthritis Management in the UK. Hi, Hannah, it's so lovely to have you with us.
Nice to be here. Thank you very much for inviting me.
Oh, my pleasure. I'm really looking forward to this conversation. I know a lot of group members are as well. I've had a lot of messages over the past days how much people are looking forward to hearing you talk a little bit about CAM and pain and your experiences. So do you want to introduce yourself and tell us a little bit about what CAM is and how you kind of got to be the leader of CAM?
I'm Hannah Capon. I'm a mere mortal. I'm a first opinion practitioner. And that's really relevant. That is really relevant because I still work on the front line, and I am definitely an advocate for what it's like to be working in mainstream, busy, stressful practice, and what's achievable and what's not achievable. And that's really relevant because a lot of the clinical data that we refer to, we look to, we take guidance is from a different circumstance, and that's going to come back later in our chat. So going back into first opinion practice has been a real good kick of we need to create more tools for that stressful type environment that we work in. So I started CAM, Canine Arthritis Management, around about 2013, but it didn't actually kind of launch until 2016. And it was really because I was sick to death of putting dogs to sleep because of arthritis and chronic musculoskeletal disease and underlying pain. And I really struggled both mentally and emotionally with the fact that so little was being done. I couldn't get my head around it, that we would be willing to do huge campaigns about Alabama rot, which at that point had actually only affected 50 dogs. You know, it wasn't a big killer. Yeah, it wasn't nice, but it wasn't a big killer, but it was getting like headline news around the world about this new problem. And OA was killing tens of thousands of dogs, and it led to severe suffering for months, if not years, prior to the only option being euthanasia. And that just wasn't getting any press. And I found that very difficult to get my head around. It was so endemic, but so apathetic, the approach to it. So I started a bit of a non-conventional learning journey. I kind of stepped out of veterinary medicine and started looking at the other more complementary integrative therapies and seeing what their take on it was. I dabbled into the behavior, I dabbled into the rehab, and then got very interested in communication and like the socio-economic kind of approaches to OA because it has a big play. And then started a Facebook page whilst I was running my mobility clinic, which was an external service. And I think that was probably my happiest time. I won't lie, it was my happiest time because it was so simple. I'd go to someone's house, I'd educate, we'd examine, we'd create a plan, I'd take photos, videos, I'd get the owner consent, and they just went online, straight onto Facebook, where people could learn vicariously. There might be a video walking around someone's house of all the obstacles that the owner hadn't noted the dog struggled with. And I wanted people to kind of learn from other people's experiences. It just went crazy. And it was just so like, good. But I think the reason was relatively, I suddenly realized there was a lot of people that cared. And I think prior to that, I'd really experienced quite a lot of apathy, as I say. And it was a really good experience to see that there was a cohort of people, be them paraprofessionals, veterinary professionals and owners that were like just tell me, I want to hear more. And that was a great experience. So then it's grown. It's now Facebook page, multiple Facebook groups, website, which a new one's launching at the end of this month. We've got an online shop, we've got an education centre, we do consultancy, practice training, which your practice has experienced. We've got online recorded practice trainings, we've got owner workshops, we've got paraprofessional workshops. It's gone nuts, really.
That's amazing. That's so good. And yeah, as you just said, that's how we kind of met, really, was you provided some virtual training for my whole practice team, I think, what, 2 years ago now?
Yeah, COVID, wasn't it? It was like in February.
Was, exactly. And I think one of the things that we all took out of it, and by all I mean, you know, my front of house team, the nursing team and the veterinary team, was just how little we knew about recognizing these subtle signs of, you know, chronic pain and chronic arthritis. And I think, you know, okay, I graduated as a vet 20 years ago, over 20 years ago, you know, and for sure at that time, we didn't get any kind of education and training into that sort of, you know, recognition of those subtle signs. And I still believe that many vets struggle with that. And so if we as vets struggle with that, you know, how can we expect owners to be able to understand, recognize, pick up on, you know, the fact that their dogs might be in pain? Did you find that as well? Did you find that that was a big learning curve, that sort of idea of just because my dog isn't limping or yelping out in pain, it doesn't mean that they're not in pain?
100%. And I have to thank a lady, a really big influence on my like career has been Julia Robertson from Garland Myotherapy, which was one of the like paraprofessional allied courses that I did. And I can remember going there as a vet professional. I like to consider myself not arrogant, like academically arrogant, but I can't say that we don't have a little bit of that aspect, because we've done like 6 years in vet school, hard graft, huge debts that you come out with. You work in a really high stressful environment, and you go on this course and you've got somebody who's in their experience and a few kind of paraprofessional courses bringing together this picture for you, and you're going, that's not what I got taught.
Yeah.
No, I don't think I believe this. And I can remember going and seeing some work experience with her before doing her course, and she was talking of things that I just was like, I'm not comfortable with this, where she was saying, well, what about anal glands? You know, dogs that develop anal gland problems, why do you always assume it's kind of like skin related, allergy related, you know, infection related? Could it be posture related? And I can remember going, what are you saying? And she was like, well, think about it. If a dog's really struggling with the lower back and hind limbs, and they're not able to take that posture to squat, what's the possibility that they don't actually defecate in the same way? So therefore, they don't defecate in the same way. Are they actually expressing those anal glands? And therefore, should that be an indicator? And I was like, oh my God. And things I can remember early in my career, people would say, my dog doesn't use his tail very much anymore. And I'd be like, oh, well, it must be aging. And I was like, oh my God, why would a dog stop using its tail? It's so important in its life. Right. I'm just not going to use my tail anymore today. I've just decided it's too tiring to use my tail. And I just can remember having so many light bulbs, and I felt rotten to the core. I cried a lot. I thought about all the cases that I hadn't helped. I'd been a vet for 10 years by that point. And I get tearful thinking about it now, because I think of all these dogs that probably walked into the room going, are you going to help me? You know, I've made it here. I've got to the vet. I've come here with a condition that you could help me. You didn't see it. And I just, yeah, I think that's the sort of thing that really drove me to do something about it. Guilt, horrendous guilt.
Yeah, no, absolutely. And, you know, I see it a little bit in the behavior world as well, because I think behavior is quite similar in the regard that, yeah, we're just not taught enough about it, you know, and all these signs that these dogs are so clearly giving us, and trying desperately to communicate that they're not happy, they're not comfortable, they're not okay in certain situations, you know, they don't want to be touched in that way, or, you know, all those sorts of things. And yeah, and we just don't see it, and we're the ones that should be advocating for that. So I feel you definitely, you know, I think the more you sort of look into this, the more you don't want to think about, you know, perhaps what you did in your early years when you were a vet, and it becomes a lot harder. And I think one of the things also in terms of pain is we're so, you know, what you just said, oh well, they must be aging. And I think, you know, that's something as well. We're doing so many of these young dogs a disservice, and cats, by, you know, not thinking about those things just because they're 10 months, 2 years old. What have you found sort of learning more about this in terms of, you know, the age of the pet? I know we're seeing things younger and younger, but I'm sure you've got some amazing
I'm going
stats
to be
share.
I'm going to be politically incorrect now. The more I learn, I do not like the human species. I think problems that we have created for our beloved companions.
Yeah.
And I know a real voice for our companion animals has been Emma Milne, who's a vet, who's been talking about our breeding of these quite extreme breed characteristics for many years. Her epiphany, her light bulb went off a long time ago, and she is an incredible woman to take the flack that she's had. But I'm not just talking about breeding, I'm talking about the lifestyles that we encourage them to live. You know, we really expect them to fit around us. There's no lies about it, is it? You know, they will conform to our way of life and our structure, whatever we think we're doing. And I just think as my journey's gone on, I've just become more and more of an advocate for animals and question why we choose what we choose, sadly.
Yeah, no, for sure. I'm seeing a case actually in next week. It's a case from the UK. You know, it's a young dog, fancy breed, 10 months old. And they have been to see, you know, a physiotherapist, a gait analyst, and the amount of problems, postural problems, it's coming to see me for aggressive behaviors, you know, which makes sense. But the amount of postural problems that have been picked up on in this 10-month-old doggy, and the fact that it's, you know, exhibiting aggressive behaviors, you know, to some degree for sure in relation to these kind of physical issues that are going on there, is, yeah, difficult. And you sort of wonder, yeah, and you wonder, what does the future of that dog look like? You know, how, I mean, and, you know, and we see the tip of the iceberg, you know, how many are there out there that don't find us, or who don't recognize, you know, and how many dogs don't show aggressive behaviors but are still in pain and are still living with that pain, but nobody, you know, things aren't bad enough, you know, the behaviors aren't bad enough for people to kind of think about investigating these things.
No, I totally agree. And I think that's a definite driver to keep CAM as it is, which is a free resource for owners. I have a strong ethical belief that this information needs to be readily, freely available, so that all can buy into it, they can get involved. And there's a huge amount of people there that love their pets, but they don't know. I call it ignorance. You know, they just don't know that they don't know.
Yeah.
Then there are a category of people that don't know, but they know that they don't know, and you're like, ah. But yeah, it's a really big concern about how the figures are going up. I've just read an article just released by Duncan Lascelles Group, looking at a new way to try and identify osteoarthritis. So they took a cohort of 500 dogs that were brought to a variety of different practices in the US for non-OA related reasons. Some of them might have been stiffness, others for just clinical preventative healthcare. So 500 dogs, owners not aware there's a problem at all, and 188 of them were diagnosed with OA. So that brings the figures that we used to refer to of 20% of dogs over the age of 1, which goes back to 1996 by a telephone poll over in America by a man, and we know men don't pick up on pain as much as women do, so sorry about that, guys. That was what we've been relating to, 20% of dogs over the age of 1. It's now 38% of dogs, and this is going up. The better we are at identifying pain, the figure continues to rise. So 40% of dogs that exist in this world are living with pain.
Yeah. And so what do you think some of the signs are that that owners can pick up on. So, we sort of spoke about the fact that just because they're not limping or vocalizing doesn't mean they're in pain. What are the subtle signs that dogs communicate to us that they are uncomfortable?
Can I step back a little bit and then go to that? Because I
just
that once we see signs, it's there. It's there. It's really burning. The fire has been lit months, if not years ago, and we are seeing the clinical signs. And I don't like the word coping, because I think in English language, we say it in a context of coping positively. She's coping really well with that course. I'm coping really well with that lecture I'm trying to write at the moment. Coping tends to have a positive connotation. It isn't actually that. It can be negative and positive, but we just tend to use it positively. So when I hear people say, oh, animals cope really well with pain, I'm like, no, that's not acceptable. They shouldn't. So I say they tolerate, because I think it's a much more neutral statement. But because dogs will tolerate a degree of pain, when we see even the subtle signs, it's very much present. So let's just go back a little bit in time before that. Let's be responsible of the breed we choose. So let's look at your choice of breed, and are they predilected to it? So if you've got a Rottweiler, if you've got a Labrador, a German Shepherd, a Pug, get them checked and make sure that you're ahead of the curve. So when you go for your health check, encourage your veterinarian to do a full orthopedic exam. Ask for every joint to be flexed and extended. Look for any subtleties that there could be a problem and act on it. Second, please don't let your dogs get fat. What is wrong with us? Okay, so this is a really, really easy intervention to potentially stop the development of OA, slow the progression, and reduce the clinical signs. So those two things, I think we need to kind of just plant those seeds. When it comes to actually picking up on the early signs, I think we should really talk behaviourally first. I think all of us know with our own human healthcare, have I got pain? Can you tell if I've got pain? No. But when I'm grumpy, I'm a bit frustrated. I'm just a little bit. That's because I haven't slept very well, because I've got a bad back, and I've woken up and I'm just a little bit grumpy, and I'm just taking it out on people around me. But it's not until I curve over like this in 5 to 10 years time, because I never did anything about it, do I look physically like I've got pain. So I think for me, behavioural identification is huge. Yes, you will see changes in posture. You will see changes in capability, gait, movement patterns. It's change or different to the norm. So unfortunately, pugs have got such a high predilection to hip dysplasia. People go, oh, he's always walked like that. And I'm like, I know, he's always had hip dysplasia. So I think if you've got abnormal gait patterning, that you go, well, that dog over there has got a really nice paced walk. Mine doesn't do that. Trots really nicely. Mine doesn't do that. Mine bunny hops up. So abnormality as well as change in behaviour, posture, physical appearance, so muscle development, coat changes, nail wearing, pads, and then capability and gait. So that's climbing stairs, getting out of the car, hesitancy. I hate it. This is another thing I hate. God, I'm so awful. And I hate it when people say he can't get in the car anymore. I'm like, okay, we missed up here, because he would have hesitated.
Right.
That he would have been, I want to please you. I'm just going to take my time. And that's when we should be catching it. So
yeah.
Sorry.
Yeah. Randy. But I think it's a little bit like you said, with the sort of the physical signs. By the time the physical signs are there and, you're bent over like that, it's kind of too late. We've missed the curve. It's like that with the behavioral signs as well. If we wait until the dog actually bites because he saw and he doesn't want to be touched in that place, we've missed all of those subtle things that came before. The changes, the hesitation at jumping into the car, the perhaps kind of, differences in social interactions with the other animals in the home, or with the people in the home. And yeah, it's I agree with you, taking it the step back, going back in time and being more aware of those subtle changes. And that means observing your dogs, understanding, what was their kind of baseline, if you like, and how do things change over time. and that can be over short amounts of time or over longer amounts of time, you know, and at which point do you step in? So I'm going to actually throw that question out to you. At what point do you step in? When would be the moment that you would say, right, now is when I've got to start doing something?
I think this is what scares the veterinary profession. And I can say this because I've trained a number of practices now, and I've seen vets' faces going, so what do you want me to do about it? You know, okay, so I've picked up subtle signs of pain in an 8-month-old Labrador that's going to live to 14. What do you want me to do about it? I'll put it on a non-steroidal for life. Seriously? And you're like, okay, let's think about this. So I think trying to identify it as early as possible gives you more options and potentially could affect the progression of the disease. Just reading a paper at the moment about advancements in human OA management, it clearly states we do not have a cure, and we still have no way to slow the progression of this disease. So I think we can definitely say human care of OA is going to be vastly advanced compared to what we're doing with canine and feline. So let's say that we're going to struggle to slow the progression. But what we do have in canine and feline care is overall health and weight. It's still such a big thing. So if I have identified signs of discomfort in any age group, but let's focus now on young, because the fear of what do we do forever, look at weight as a priority. Look at lifestyle, exercise and activities that might exacerbate. Look at controlling pain, and that might be an interim basis. People think you get put on a medication and that's for life. It's not. You know, we might need to use an anti-inflammatory during the period to get the weight of the dog, to look at the activities that aggravate the condition, to maybe see a physio and get some strength training. And actually now we've got solid joints that are nice and comfortable, we can phase that away. And we can maintain on lifestyle modification, weight control, strengthening exercises, etc. So I think there is so much you can do. And I think it does scare a lot of people of identifying it early. Are you going to run out of options, or are you going to be stuck on a treatment plan for life? No, it's a very changing picture. And something that really excited me from this human paper is it clearly states in human OA, which is different to canine OA. Canine OA is secondary to developmental joint diseases. That's the majority of cases: hip dysplasias, elbow dysplasia, osteochondrosis, patelloluxation. And that makes sense because we've got a lot real dimorphism in the canine species. It's the species across the planet that has the most widely varied body type. So that makes sense that we've got really weird joints, you know, because we've got and Dachshunds to Great Danes and Bull Mastiffs. So it kind of makes sense that we're likely to have lots of abnormally forming joints because we've got such dimorphism in that breed. Anyway, back to the point. But human OA is definitely much more age-related and trauma. However, this commentary applies to both types. Mechanical forces have a definite role to play in the degeneration of cartilage. Mechanical forces, this is impact forces, torsional forces, this is the activities that we do with the dog, the weight that they carry, this is the repetitive ball throwing, this is the jumping in out the back of the car, this is sliding on the laminate floors, these are the injuries that we don't attend to, this is the ligament sprain that we had 3 times in a row this summer and it now led to, do you see what I mean? So I think there's so much that we can do, but it involves like communication, and first opinion practice really struggles to have these conversations because time's so limited.
Yeah, absolutely. And I think that's, you know, when you're looking at sort of preventative behavioral advice, it's probably a little bit similar in that, you know, there is quite a lot to chat through. And I know, you know, one of the things that you love are, you know, having rugs around the house so that you know, you prevent that slipping on those surfaces, those kinds of things, and you know, adjusting exercise patterns, strategies to suit the dog and to kind of prevent those mechanical forces on those joints. And where do you take the time? I guess that's, you know, where CAM is such a great resource, because so many things are on there that owners can kind of go to and find all of that information and find all of that advice. And what you mentioned earlier about, you know, if you've identified that a dog is painful, you kind of do that sort of almost first aid. Yes, you give medication for a period of time to kind of reduce inflammation, and then, you know, you're back on a solid joint, and then you can adjust lifestyle. And it's a little bit similar in behavior, in that I'll often, you know, say to people, we need to do some behavioral first aid here. We need to help the dog get through this acute phase that they're going through. And in the meantime, we need to make adjustments. That's going to take time. That's going to be habit changes for the people as well. And that takes time. You know, if somebody's thrown a ball for their dog for, you know, the last 30 years, asking them to change those habits is going to be quite difficult. And that's where we need to provide, I think, that behavioral first aid for the animal, behavioral and pain first aid for the animal, whilst we kind of, you know, put into place those habit changes, those lifestyle changes that can sometimes be quite difficult, I think, for people to get their heads around.
But you've said something again, when I said one of the things right at the beginning that frustrates me is humans. Is done. Again, it's quite frustrating because it's humans, what will you do? And this OA is definitely a disease where the emphasis is on the caregiver of what are you willing to do? Yeah. What are you willing to change? What are you willing to modify? So I found over the last, 10 years that I've been doing this, communication and trying to get a concordant treatment plan where the owner and the therapist, the veterinary professional, have that discussion of what can we do? What are you willing to do? How much can you do? What can you commit to? What you know, is so important, and something that just because of the limitations of first opinion practice, blah, 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 we don't have an opportunity to do that. And when you look at the literature that's out there to help identify OA and give owners tools to best manage it, those tools are very dictatorial. They're not very conversational, aren't they? You know, and I think that's what Cam's trying to do, is create conversation, you know, easy, light-hearted, same level, we're doing this together. And that's something that I really want Cam to keep, is there's no hierarchy of being told. It's a discussion and it's a learning journey, hopefully for, you know, for both parties, really.
Yeah, absolutely. I think when you take that dictatorial approach, you know, people are then less likely to follow through. It's a little bit of asking the questions, you know, of what can you do? What's realistic? You know, what are the easy wins? Putting down some more rugs in your house, you know, stop throwing the ball. You can do other things when you walk your dog. But it's yeah, like you say, it's setting up a conversation. And I think I found the same in my behavior practice as well. You know, once you start telling people you must do this, I mean, yes, there are some instances where I say you must not let the dog bite the child anymore. But, you know, if you start saying you must do this, you know, you can't do this anymore, and, you know, it will only work if you do that, you see people glaze over, and you see them just like, whoa, you know, and then you've lost them, and then you've lost that conversation, and you've lost, you know, the influence. I don't like that word, but you lose, you know, the conversations that you can have with them. So, you know, I think taking the approach of, right, you know, what can we do together? What's going to fit into your lifestyle? You know, what are easy changes that you can make that are going to really help? You know, I think that's such a lovely approach to take.
Takes time.
Yeah. So what resources do you have available in CAM for people? Let's say people that are watching our chat today, if they want to kind of, if they think, oh my God, yeah, I'm up for this, I really want to, you know, see what's out there that I can make a change. What resources have you got, Hannah, that they can tap into? Millions.
Quite scary, actually. So the Facebook page is just incredible in that it's been running now since around about 2012, 2013. If you were, you know, brave enough and you had the computer power to go back and scroll back to 2013, you'll see a different me doing look through the keyhole, because it's the same social media platform that I started on. It would be so funny to look back. But anyway, so Facebook, we have daily tips. We have interviews with experts and specialists every week, if not twice a week. All those videos are available on Facebook, but they're also available on our YouTube channel. So that's such an easy resource to tap. On YouTube, you've got a search function, so you can either put the topic, maybe it's cruise ship disease, maybe it's obesity, maybe it's pain management. You can use that search function really easily. We've got a website Now, I wrote that in 2016 when I didn't know half of what I think I know now. So we've rewritten it and we're hoping to have that launched. On there, there's lots of downloads and tools. Probably my most two favorite downloads is the Suspicion of Chronic Pain document, which is a simple PDF, and it has a structure where behavior change, 3 places you can write, posture change, 3 places you can write, physical changes, 3 places, capability and gait. And you, as the owner or the pet professional, can write what you see, and that can be taken to the vet, or the vet can fill it in and give it to the owner. And it's such a clear-cut communication tool. And the other one that I love is hashtag It's My Home Too, which is a 17 questionnaire to prime people to think about the environment that we choose our dogs to live in. And that gives me a brilliant tangent just quickly to talk about my friend's dog. And I know that they're probably going to go, oh, I wish she hadn't said that, but I'm not going to name names. I went to look at my friend's dog recently, and it's a young Cocker Spaniel, and they're in a quite big open plan house, and they are in a period of dog ownership where they love seeing their dog go crazy. And
God, yeah.
Ridiculous greeting at the front door, and they like to see the zoomies, and they think it's just so nice to see their dog loving them. On a slippery floor, my heart fell. I couldn't believe it. It was like a bowling ball going across all the alleys of a bowling alley. You know, bouncing off the walls and slipping and sliding and falling in the hip, and front legs splaying out and pulling all through the pecs and landing on its head. And I was just like, so you want me to talk about things you can do early in life? That's a no-go for me. That's why it serves no purpose apart from making that owner feel wanted. It doesn't help the dog mentally and emotionally. It doesn't help the dog physically. Stop it. So blunt, aren't I? I'm terribly blunt. But there you go. Back to the resources. So we've also got other Facebook groups. We've got Canine Arthritis Equipment and Review page, where you can look at products, because there's a lot of crud on the market. It's completely unregulated. There's harnesses that are like borax bikini. They're completely useless. So if you're going to invest in mattresses, bowls, coats, harnesses, please go there. There's a lot of people's experiences with products. We've got Instagram, which I still find hard work. It's so flick through, isn't it? But we use it to try and get short, sharp messages out. We're also on Twitter. There's others. We're going into Pinterest next. We've got cameducation.co.uk, and if people think, do you know what, I really do want to know more about this, I don't want to just scoot for Facebook or Instagram, I want to do a little course. Well, there's an owner course. It's 12 modules. Each module is about 20 minutes. It's called Cam Essentials, and it's focused on you, the owner, to try and get you to have a greater understanding. And it does everything from pain control, supplements, weight control, exercise, everything. If you're a pet professional and you're thinking, I need a higher level so that I can take this information and teach and I can influence, then there's Cam Advocate level 1. There's going to be some more of those. So there's that. Those are some of the resources. We've got the shop. We'd love people to use the shop, but the problem is, what with current situation, international shipping is becoming utterly impossible. So please do go and have a look and say it's wonderful, but I think shipping costs now are just ridiculous. So you influence your purchasing from the country that you're in. Yeah, no, that's amazing. Millions of resources. So yeah, I'm sure there's something there for everyone. But I love the equipment page. That's such a brilliant thing, because you're right, there is so much on the market, and how are people supposed to know what's good, what's not good? You know, I think about supplements, and I'm sure it's the same for pain, you know, and joint support supplements as it is for behavior supplements and calming supplements. There is so much stuff out there that has no evidence base, that is not, you know, backed up by any research. And people spend so much money on something that has no evidence, you know, and they're trying to do the right thing. They're desperately trying to do the right thing. So having something that is, you know, a little bit sort of
give some guidance on those things, I think is brilliant. Yeah, we see that so much.
Let's just
well.
use that story, just to be facetious. Let's just use that story of the lovely Cocker Spaniel that's the bowling ball in its home at the age of 1, so it hasn't finished developing yet, so there's still potentially some growth plates open and all of this sort of stuff. And what if that owner decided to spend $80 a month on a supplement? Is that going to make any freaking difference to that dog?
Right.
No. But what would make a difference to that dog is for that owner to go, actually, this is a behavior that is not suitable for my dog, and I need to invest the time, which costs nothing, into encouraging my dog to come to me at the door and wait patiently for me to greet, so we don't have any of that physical disaster. And that's where I'm at. I'm sit there seeing all of these products, and they all just seem to be vastly inferior to simplistic, logical approaches to management.
Yeah, no, I totally understand that. And that's sometimes hard, isn't it? Because, yeah, I think sometimes it's easier to just throw money at it and kind of hope that it helps than actually change your mindset about something, change the emotions that are kind of intertwined with that. You know, again, the bowling ball Cocker Spaniel is a perfect example. It's reinforcing for the owners to see the dog doing those behaviors that are essentially going to be a problem for it in the long run, for its health in the long run. And so tapping into that, you know, we've got to change that, that kind of, oh my God, he loves me, he's so happy to see me, that sort of emotional aspect around it. And that's potentially more difficult than to say, oh yeah, purchase, these supplements for $80 a month and, everything will be good. And that's
just going on that, sorry to butt in.
That's right.
Brought up something I'd read. They did a study about feeding and that owner-animal bond, and the fact that we've got an obesity problem with 67% of dogs being overweight now, and all the health consequences. And one part of the study identified that 29% of owners got pleasure out of feeding their dog, irrespective of the health of their dog. So they admitted that it made them happy to feed their dog, even if they knew it wasn't right. And yeah. I'm like, here we go again. We've got to be responsible, haven't we?
Yeah, absolutely. Responsible pet ownership. And I mean, that goes across the board, right? I mean, responsible pet ownership is such a big topic. And yeah, I know. It's
big topic. Sorry, there's me getting my little ranty. But what we could do is definitely have a quick review of interventions for pain management, so that people can feel that there are, we're not just telling the world that there's a problem and not telling you how to best manage it. So looking at what is currently available, I think for anybody listening going, actually, I think there is underlying issues here. I think there might be a pain component. First of all, go and get checked out and get your vet to do a full clinical exam. And it may lead to them offering you radiographs. That isn't ideal, so that we can get to the bottom of where that pain is coming from, how severe it is, and what your options therefore are. But with regards to looking at pain management, weight control, exercise restriction and modification, lifestyle modification at the home, so stairs, jumping out of the car, etc. Non-steroidal anti-inflammatories, which are wide and varied now. And I know a lot of people read bad press, but actually the reason that we know about the adverse events is because they're recorded, whereas all of these other interventions that are freely available to purchase, there's no regulatory body. So you wouldn't even know if they had adverse events because it's not recorded. So non-steroidals still have more evidence of benefit and being of low risk than any other intervention that we currently know a lot about. So there's non-steroidals, and they can be daily, weekly, monthly. Then we've got our monoclonal antibodies that have you got them over yet?
No, they're going to come, but no, not yet.
Yeah, so they're really exciting, seeing some great stuff with that. Then we've got an array of adjunct analgesics that we can use in combination with those. So from paracetamol, gabapentin, pregabalin, amantine, amantadine. We've got many interventions as veterinary professionals, be it constant rate infusions, be it depot injections. So don't be scared that there's nothing that we can do. And as we said earlier, it's a changing picture. So what you use at the beginning may not be what you're doing within 2 to 3 weeks. So don't be scared of outlay and commitment, because it's a changing picture. In the nutraceutical world, which is where everybody goes to because they get their iPad out and they start raiding for what they can pick up online, omega-3 fatty acids, marine-based source, 100 milligrams per kilogram, so DHA, ETA, and EPA. So we're talking marine-based. Don't go into plant-based, not flaxseed oil, etc., not hemp oil, that sort of stuff. Hemp oil, CBD, different. Talk about that later. Yes, there is some evidence with regards to things like boswellia, eggshell membrane. It's weak. Turmeric's very weak. Glucosamine and chondroitin sulfate, very weak.
Yeah.
So please just don't kind of go, I'm going to spend a vast sum of money here rather than see the vet. You would get more out of seeing the vet and having a treatment plan. And then you've got all of your complementary therapies, which I call integrative because I think they play a massive role. As simple as massage. Then you've got things like infrared and heat and cold have a massive impact. We've got our laser therapies. Please don't get into the trap of buying LED light sources at $200 handheld because their ability to penetrate deep into tissue is just not there. But we've also got things like pulse electromagnetic field therapy, shockwave therapy, hydrotherapy, therapeutic exercise description, so getting a physiotherapist on board to help you with the appropriate exercises and targeted exercises. So there's a big wealth of stuff there as well. So there's loads and loads of things that we can do. There's also a category that I always have people say, don't forget, is surgery. Now, if you're identifying the subtle signs of pain early, if you've got a dog that's showing signs of maybe elbow discomfort because when they walk, they circumduct. So instead of flexing and extending, they kind of whisk a little bit, little whisk. Bear in mind that these conditions are often bilateral, so you're not going to see an obvious lameness, but you might see a dog that doesn't lay in sphinx, but lays in sphinx, but with the elbows extended, things like that. So early identify these joint-related pains, you might find that there's a disease modifying surgery that can be implemented. So that will deal with the fact that the joint is not forming how we would like it to. So if we meddle a little bit, we can actually get it to grow the right way to the best of our abilities. There are salvage surgeries as well. So things like hip replacements, femoral head ostectomies. And you've also got your stabilizing surgeries, such as your cruciate stabilizing surgery. So there's that area. And then there's the newly developing area, which is really exciting, which is our intra-articulars. So we've got an array of things that we can put in the joints now for a much more targeted approach, be it all the way up to the hyped up stem cells, down to the simple steroid for an end stage joint. So looking at what is out there, it's crazy. There is so much.
Yeah. And I think the biggest takeaway from this is like, there is so much. And yet the thing that I think most people tend to go towards, and I'm talking about vets as well as owners, are the supplements. That's where everybody goes, because I think, it's deemed as being kind of safe and, not too invasive, but it's still going to do something. And I think that's one thing I want to really just sort of kind of bring home to people is there are all these things. And yes, some of them will require support from a vet, from a physiotherapist, from a rehab specialist. It's good that there are going to be professionals that need to work with you on some of these things that we know have potentially, really great effects. But the things that don't have maybe the evidence, or very weak evidence, are the things that I think people tend to go for. The turmerics and the glucosamines and all those kinds of things, because they're just deemed to be safe, easy. You can buy them off the internet. You don't need to get anyone involved, and that makes me sad, because I think they're potentially the ones that people spend a lot of money on, and they're not really going to be that effective, whilst there is so much that can be done.
And I think there's kind of like 3 points. First is a horror story. I'll quickly tell you my horror story. This email from somebody saying, I didn't know you endorsed a supplement. I was like, we definitely don't, 100% no. And she was like, wow, your face is on a supplement. And I was like, wow. So we found the supplements, and indeed they're taking a photo of our website of me and put underneath veterinary approved. So they hadn't said doctor veterinary approved, but they'd certainly misled the purchaser. So we couldn't find any contact details of that product. but we could see it was being sold as the UK's #1 joint supplement.
Oh my God.
Okay, so this is great. It gets worse. So we then chose to look up the company under Companies House, and it only launched 3 months before. So how the hell they'd become the UK's #1 joint supplement in 3 months? I'm pretty sure that's impossible. And we were like, well, this is really interesting. We can't get any contact, so I don't trust this product. There's no way to contact the company. There was no list of ingredients. There was no breakdown. There was nothing, no lot numbers, nothing. So we looked at about 10 to 15 Facebook posts, and we found the first person to like that post was always the same. So we assumed that that must be either somebody to do with the company, the marketeer, product owner. So we found him. He had an open Facebook profile. So we managed to research. We went through his history of him, and he'd been selling supplements to the bodybuilding industry, and his company had failed. Okay. So his company had failed within a year prior to starting this one. And so seriously, guys, you know, it's completely not regulated. Trying to get our face, my face of this product was nigh impossible. He used a marketing company in India that we trace down and go, stop using my face. We want nothing to do with you. So that just demonstrates that there's a world out there that is just there to make money. Supplements do not have to prove that they're effective. Remember this, they do not have to regulate themselves as safety. They don't report in adverse events. They will follow under what's called good manufacturing processes, so GMP. So they've just got to prove that the product in there is produced safely. They don't have to commit to the right amount. So even if it says 500 milligrams, there might only be 300 milligrams in there. So wow. Yeah. And I even found out what you say on the front of the packet can be different to what's on the back of the packet. Yeah. So it can be very misleading marketing and stuff. And I just, knowing what I know now, I don't want to bring the nutraceutical industry into disrepute. There's some really great companies out there that take it very seriously, and they have really good control processes, and they're looking at educating, and they're looking at trying to develop clinical evidence. But there's a lot of stuff out there.
Yeah. And it's scary. Like, yeah, it's really scary. The same with nutraceuticals for behavior, exactly the same thing. You know, it's a minefield. That absolutely is. Yeah.
Gave me actually another thought. I need to talk to people about arthritis being acute on chronic, because give people the opportunity to stop suffering from caregiver placebo and something called regression to the mean. So one of the big problems we see is that owners identify the disease pretty late, and they identify the disease when the signs are overt. So the lameness is pronounced, the dog's behavior is severe. And at that point, they choose to do something about it because they've noticed it. But that tends to be when the dog is going through what's called an acute flare. So arthritis is a slowly progressive disease that has flares. And the flares are often linked to incidents, jumping out the car, overdoing it, etc. So when the owner sees an incident, they then bring in an intervention, a supplement, a new therapy, a handheld LED light device, whatever it might be. And they start using it. And because the dog's getting better, they do correlation. It must be causation. They must, therefore, that must have caused that. And it's not. Correlation is not causation here. The dog was going to get better anyway, because an acute flare generally lasts 7 to 14 days. So the dog will get better. So what you have to be aware of is that it's about having a long-term benefit, in that over time, the acute flares become less, they become fewer in number, the overall state of the dog improves. So just look after yourselves. I think the more I know about osteoarthritis, the harder it is, you know. And the other thing, we talked about it before, the more you learn. So people look at me going, you must know so much now. I'm like, I feel like I know nothing.
Yeah.
The more I know, the more likely I am to say, this may and this should and this we would like this to, but nothing comes with a promise. So if you meet people that tell you this is definitely going to cure your dog's arthritis, run a mile. Yeah, because that just doesn't exist, does it?
No, it absolutely, and it's so the same in the behavior world as well. And I think arthritis is actually quite similar, because whilst arthritis has a very sort of set disease process, I guess, and what happens in the body is quite similar, I still think that likely no two cases are ever the same, right? Because you have differences in, sort of early life. You've got, differences in environment. You've got differences in activity levels. You've got differences in this particular dog's triggers that might cause flare-ups. Bizarrely, here in the UAE, I see the most acute on chronic flare-ups in December and January, when it's about 25 degrees here, which sounds so ridiculous, doesn't it, when you're speaking to you guys from the UK. But because we have quite a noticeable change in temperature, from the summer to those sort of winter months, December, January, February, and that's when we see those acute on chronic flare-ups. And again, that's different, the climate that an animal might live in. My sister's horse, for example, he was 18 when he came to the UAE. He got a second lease of life because he was so much more comfortable when he got here, because he felt he's got kissing spines and he felt great. So all those things, I think, play such an important role. And that's why no two cases are ever going to be the same. And that's why you can't make those definitive statements, because your dog may respond differently than, the case that I saw yesterday or this morning. And it's very much the same in the behavior world. There is so many, one owner might have a different view. One owner might be willing to do other things and, buy into other things in terms of, adjunctive therapies and that sort of thing. So no two cases are ever the same. And I think that's where there's such a crossover between these sort of chronic health diseases, behavior, anything that's, not a wound that we need to stitch up, but anything that's a longer term management thing. There are so many influences that you can't say definitively, this is what's going to happen.
Agree. 100% agree.
Yeah. So we're almost at the end of our hour. It's been so great chatting to you, Hannah. I know that you and I are both writing lectures and bits and bobs at the moment. So I really appreciate that you've taken this hour to spend with us. And to anybody who's either watching this back or that's joined us, please check in to Hannah's resources. I'm going to put them just under the live, and I'm also going to put this video up on our YouTube channel. So and I'll post a link in the group so that people can find us. Have you got any parting words of wisdom? Anything else you'd like to say before we call it a day?
Definitely your dog more years, which is our hashtag, in that if you identify the signs and you start getting a multimodal management plan, which doesn't have to be expensive, you will get more years. We're not talking weeks, we're talking years of comfortable, happy life. And that is what everybody wants, isn't it? We get a dog for them to be with us for as long as possible. We desperately getting them 16, 18 years, as much as we can. Let's make sure it's comfortable. So please do look at those subtle signs. Don't be scared of speaking to a veterinary professional. If you're not getting the answers that you feel are going to help you, seek out another veterinary professional that's got more of an interest in pain management, and implement a multimodal strategy, be it weight, be it activity modification, lifestyle changes, home modifications. It'll make a big difference.
Yeah. Super. Such great advice, and such an important topic. So thank you so much. I'm sure this is going to be of so much value to so many people. And on that note, I'm going to say goodbye to everybody. I'm going to post a few things on pain in the group over the coming days, so check those out. And yeah, we'll chat to you at the next live. Thank you so much, Hannah.
See you later.
Bye.
Bye.
Alrighty.
Oh.
So good.
Okay, it wasn't too ranty.
No, I think people need to hear it, and I think people will really appreciate everything that you said. So no, absolutely perfect.
It's just, I think you must be the same as me, that the more you look into something, we're just weird species, aren't we?
We're a rubbish species. That's what we are. We're just rubbish.
Yeah. And I look at the fact that we all say we love our dogs. So I have to check in on myself, and I'm going, I love Luna. Am I doing what she wants as much as what I want? am I doing what's good for her as much as what's good for me?
Yeah.
And it's quite a hard process to figure it all out. Yeah. So
yeah, no, it absolutely is. It's, and you know, kind of learning more about behavior and learning more about species specific needs and how we control everything that they do, and you know, kind of don't meet their species specific needs because we want them to fit into our lifestyles. I think you mentioned it earlier. It's crap, like it's rubbish. I'm bringing my horse back to the UK in two weeks. We fly just under 2 weeks. He flies back, and I promised him he has never got to come back to the UAE. Like, even if I have to retire him, you know, because I think there's just something now where there are just some things that I just can't live with anymore. I can't live with him being in the desert and living in an air-conditioned stable for, you know, 6 months, 7 months of the year. I just can't do it anymore. And yeah, and I wouldn't have had those thoughts, you know, 5 or 10 years ago when I wanted to compete him and, you know, all that sort of stuff. And yeah, things change. You know, I think we evolve and hopefully we get better. But I'm the same as you. I hate sometimes looking back to my early years in practice and thinking, why did I pin that dog down to do that?
Yes.
Like, that was ridiculous. Like, what was I thinking? What was I thinking?
Yeah.
And yeah, and I feel ashamed and guilty by some of the stuff I've done.
Yeah, no, I do too. And you, it's one of those things that you want to kind of talk about because you want to have almost complete disclosure that we all make mistakes, but there is part of you when you're on a social platform and you know that you've got a public role, somebody will use any opportunity. So it's a fine line that you're cognitively trying to process what you're about to say on an online, trying to be ahead of the game, but do you want to say that? Because that could actually backfire on you. You don't want to lose this kind of professional status where people trust you by saying, well, I made a mistake. And it's so weird, isn't it?
Yeah, it is. But I think people appreciate us for being honest. I think people appreciate that, you know, we say, yeah, I fucked it up. Like 15 years ago, I was shit, you know. I mean, I wouldn't say it in those words. I'm saying that to you now, but you know, yeah, for sure. It's a fine line, like you say. You've got to kind of show that you're vulnerable and human, whilst at the same time just kind of making sure you don't go too far with that, I think.
No, I agree. Right, I better go.
Alrighty.
Lovely talking to you.
You too. Thanks so much. Chat soon.
See you later. Bye.